Hello and welcome to another episode of the Daily Remedy Podcast. Today I'd like to talk about something that's near and dear to my heart, my own clinical practice. And I want to talk about deceptive pricing strategies in the GLP-1 space. For many of you who have looked at GLP-1 medications, I'm sure you've seen the ads, you've been flooded with just all sorts of propaganda where they tell you, buy here, save here, and you're not quite sure what to do in terms of the pricing situation. So what we've seen is that the GLP-1 telemedicine market, semaglutide, tirzepatide, what have you, has rapidly evolved into a direct-to-consumer healthcare market, and it's created a fertile ground for deceptive or opaque marketing strategies. And so, while they're not outright fraud, that's we cannot go to that strategy. We have to talk in a realistic sense. What they're doing is engaging in deceptive or opaque pricing strategies by obscuring what the true price of the medications are, by creating this sense of perceived discounts or bundling different prices together to give off the appearance of cost savings. And a good example of this would be TrumpRx. So many of you have heard about TrumpRx. It's trending quite a bit on social media and internet searches. It is not a discount GLP store. It is a coupon aggregator. So the prices that are listed are not actually the price that you would purchase the medications from. In fact, the prices that are listed are potential prices that you could get if you're able to aggregate enough coupons together. So essentially what it is that it's a choose your own adventure where you go to the website, you click on a medication you want, you think you're getting a certain price, and then instead you get a bunch of coupons and a bunch of follow-up paperwork to go to your insurance company, to your provider, and then essentially say, hey, can I get this medication at this price? If you want to go through the maze of price work, sure, maybe it'll work out for you. If you don't, then, well, too bad, so sad. That is not a discount pricing store. That is simply an online outlet that tells you the potential price you could get if you aggregate all the coupons together. So I guess the question then is like, why does price deception thrive? Well, because first and foremost, you, the patients, act more like retail consumers than patients. And that's not a bad thing because healthcare consumerism is on the rise and it's a trend that's here to stay. But what it effectively shows is that by patients looking at different price comparisons and ascribing price to value, people are creating a false sense of value by manipulating the price. And I think that's the key thing to understand. When you have a fragmented supply chain and you have pricing that varies across different channels from like $99 or $49, which I think Hims or her tried to do a few months ago, to $1,400, $1,000. The reason being is people equate price value and brand recognition, right? So price, value, brand recognition. It's a triangle. And so by manipulating the value based on the perception of the brand, they can trick the consumer, the patient, into recognizing different prices that may not necessarily be true when looking at the full scope of clinical care provided. The best way to look at this would be the membership fee illusion, right? So you'll see a lot of places like the Join Mochis of the world that'll say $99 a month, membership fees, all you can have, like a buffet, right? And then all of a sudden you start to get back channel prices on lab work, on physician consultation, on shipping fees. So these membership fees are essentially an illusion to get you to obtain your payment information, and then start charging you over and over for different clinical services. And if you, the patient, complain, then they'll come back and say, well, you didn't read the fine print. You didn't read the consent form. And you saw that strategy kind of wipe away in other industries because there were a sufficient number of consumer complaints that would essentially weed out those types of practices among different companies that are doing that. In healthcare, the reason why you don't see that is because that illusion of price to value still exists. So different brands will say, well, because we are X, Y, and Z, because we are Cleveland Clinic, because we are Mass General, we have a greater value, and therefore our pricing should reflect that greater value. Now, apply that logic to RX, to Join Mochi, to any of these other telemedicine brands, and they'll say, well, we are X, Y, and Z brand, therefore we provide additional value. And so they justified the pricing shift as a way to claim that is the value. Now, the term for that is called a drip pricing strategy. Now, the drip pricing strategy essentially fails to disclose the full upfront price and just lets you think you're paying a certain amount, and then drip by drip by drip charges you more over time. And so the hidden components for many of these can be upwards of like $200, $800 annually. So if you're thinking you're paying $100 a buck, right? So $99 a month, the hidden price is really going to add up long term. So think about it in this sense, okay? So you got price, you got value, and you got brand. You see a brand that has a lot of online presence. Because of the presence, you become familiar with it. Familiarity breeds interest, so you go and check it out. You see a brand recognized telemedicine platform. They'll then start with an anchor price. And based upon the brand and the anchor price, you'll say, wow, I got value, right? But that anchor price is essentially a facade to give off the pretense of value. And then over time, you start paying based upon how long you're a member. So something that may be $49 one month, maybe $99 the next month, $149 the next month. But the sense is that, hey, I'm already part of this telemedicine program. Let me continue. Why change? So essentially, they create these price dripping strategies where the price of the medications, particularly GLP-1s, can increase dramatically as the dose increases. So for us in the healthcare consumerism market, what can we do to address this? Because truth be told, healthcare consumerism is a vital part of patient agency, and it is essential, particularly in this post-pandemic world of medicine, that patients have the agency to act as consumers as opposed to blindly led patients. So we're not disputing the overall construct of things. What we're trying to do is educate patients to recognize that price, value, and branding are a complex triangle that can lead to deceptive pricing practices by creating a false sense of value based upon the brand. So by using different brand recognition and manipulating the pricing to create the pretense of value, they create different pricing strategies known as a price drip strategy to get you, the patient, to then purchase more than you would originally thought. Now, we've seen stuff like this, let's say in the Netflix of the world or Amazon's, where there's a subscription fee, there's a cancellation fee, what have you. AT&T, Verizon, what have you. They are big abusers of this practice. The Consumer Finance Protection Bureau has gone after these companies for those types of deceptive tactics where they'll tag on an extra $20, tag on an extra $10. As I mentioned before, the reason why that hasn't really been weeded out in healthcare is because there's still this dichotomy between a true consumer and a patient consumer. But I think we have to start to recognize that the pricing strategies that are used by these companies are very much in line with some of these retail brands and not fully in line with what is in the best interest of you as a patient consumer. So I think what we really need to do is look at what is a true discount in healthcare and figure out whether that really applies to me, the patient. All right. So a lot of platforms, when they present themselves as discount marketplaces, they're not truly offering a discount, right? So there may be like a lead generation fee or a referral fee. The key thing I would ask you to do is to be very proactive in asking about the price. Gone are the days where price is taboo to discuss in healthcare. Pricing is everywhere, and if insurance companies can do it, and if hospitals can do it, we can do it. So we have to be very upfront in discussing pricing with providers, because we as patients need to make sure that we protect ourselves from deceptive pricing tactics. So, in short, recognize that many of the telemedicine and online presence, even the brand names like the Northwestern, Mass General, Mayo's, and Cleveland Clinics of the world, are engaging in practices where they are not fully transparent about the true cost of care. They leverage the value perception play to create a drip pricing strategy that exploits their brand to create the facade of trust to get patients to pay more money than they would otherwise. It's not necessarily illegal. It is borderline unethical, but it is a factor in the world of healthcare consumerism that we live in. And the main thing that we need to do as patients is to empower ourselves against that and recognize when we might be at risk of a drip pricing strategy. All right, I'm Dr. Joshi. This is Daily Remedy.